PROBASE trial is a population-based, risk-adjusted prostate cancer screening trial in Germany. In this secondary analysis, authors aimed to optimize prostate cancer screening by defining low-risk groups using baseline PSA levels in men starting screening at age 45. The trial recruited over 46,000 men, with 2,300 approximately undergoing immediate PSA testing at age 45. Participants were categorized into low risk if they had a PSA level of less than 1.5 nanogram per ml, intermediate risk if the levels were between 1.5 and 3, and high risk if it was over than 3 nanograms per ml. PSA positive screen test was defined also as anything over 3 nanograms per ml. Follow-up screenings occurred at 2 and 4 years for intermediate risk men and at 5 years for low risk men. The primary endpoints were PSA positive rates and prostate cancer detection. The results showed that 89% of men had PSA less than 1.5 nanograms per ml, and only 0.45% of these men had a PSA greater than 3 nanograms per ml at 5 years retesting. Ultimately, 9 cancers were detected among the 14,000 low-risk men, translating into an incidence of 0.13 prostate cancer cases per 1,000 person years. On the other hand, in the 11% of men with a baseline PSA between 1.5 and 3 nanograms per ml, in this cohort, 13% of men progressed to a PSA greater than 3 within 4 years, and this ultimately detected 58 cases of prostate cancer, translating into a prostate cancer incidence of 8 cases per 1,000 person years. Finally, in both groups, most of the prostate cancers detected were clinically significant. To conclude, men with a baseline PSA less than 1.5 at 45 years of age have a very low risk of prostate cancer and do not require retesting for the first 5 years. This data will help better define and consolidate current recommendations. This strategy reduces overscreening, potential overtreatment, and costs, supporting more efficient screening and possibly improved compliance among middle-aged men.